Hey, it's Ethel with the Global Health Pursuit podcast. It's been a while, but I finally got around to launching another season, and I'm happy to be back. Even though I'm recording this intro with a stuffy nose, I just had to get it out there. Today's episode is all about refugee well-being, and well, it's one that might make you question the ethics and policies of the U.S. government. Maybe in a good way or bad way, depends on how you see things. But I'm just here to share some dialogue with an expert who's been on both sides of the equation. According to the AmericanImmigrationCouncil.org, U.S. immigration law is based on the following principles: the reunification of families, admitting immigrants with skills that are valuable to the U.S. economy, humanitarian protections, and promoting diversity. Now, there's an 18-page fact sheet that provides basic information about how the U.S. legal immigration system is designed and functions, which I'll link in the description and show notes of this episode. But after having this conversation with Dr. Mitra Naseh, our guest today, I realized that these policies are a little bit more tricky and complex than meets the eye. How are you seen if you're forced to migrate to another country? What if you're highly educated? What happens after you've successfully immigrated? Is there anything you still have to worry about? All of this ties into the mental and even physical well-being of the refugee or the displaced individual, and that's what I find so fascinating about this conversation. My name is Ethel Bauman, and welcome to the very first episode of Season 2 of the Global Health Pursuit, a podcast for beginner learners, seasoned public health professionals, and fans who just love hearing inspiring stories from leaders who want to make the world a better place. Our guest today is Dr. Mitra Naseh, an early career forced migration scholar. She currently holds the position of assistant professor and serves as the co-founder and research director of the Initiative on Social Work and Forced Migration at the Brown School at Washington University in St. Louis. You can learn more about Dr. Naseh by visiting the show notes linked in the description of this episode. Make sure you're subscribed to this podcast, leave a 5-star review, and share this episode with someone who might find it valuable. I'm a one-woman show, and believe it or not, it helps me grow the show immensely and helps me make it 1% better every day. Let's get into it. Dr. Naseh, it's so nice to finally have this conversation with you. Can I call you Mitra?
Yes, of course.
Yay! Okay, awesome. It's so interesting because I have been interviewing so many of your colleagues, and we were just talking about how it's nice to have it in an educational setting where you're able to learn about other people's stories. You work with these people, so it connects you so much more. And, we're going to be talking about the intersection between social work and refugee well-being. But there's always a origin story in terms of why you get into this space, right? So what's your story?
So I was born in Iran at the time of Iran-Iraq war. And for the past 4 decades, technically as long as I have been on this planet, my home country, Iran, has been one of the largest host countries for Afghan refugees. My parents are both individuals who are very concerned about social justice, equity, and these concepts. So it was kind of natural for me to care about refugees in my home country, basically Afghan refugees. I started volunteering and doing internship in refugee serving organizations from very young age. And then I was hired by one of these organizations as a staff working with Afghan refugees. I wrote my thesis, class projects, pretty much everything about Afghan refugees. And later on, I joined United Nations, again, working mainly with refugees. The last position that I had before being in academia, I was part of the regional program for Afghanistan and neighboring countries. I was based in Iran, but I was working in 8 countries, including Afghanistan and 7 other neighboring countries.
I took a quick look at your resume, and it said that you have a bachelor's degree in computer engineering. So how do you go from computer engineering to this work? It's so different.
So for sure, I wanted to know that I want to work with refugees. But at the time when I was taking the exam in my home country, there is an entrance exam for higher education. And I was a good student. So everybody wanted me to have a good job, good future, and computer software engineering was the trend. It was on the top of the list of many young people going to university. So I put it on the top of my list too, believing that my future life will depend on it, how much money I will earn and all of that. And of course, it was a mistake. I was miserable.
Oh gosh.
Miserable. I think I only survived it based on like friends helping me getting by and being done with the project. I was studying 2 majors at the same time. The second one was economics, thank God. And I pretty much was spending all my time on that because I was very focused on poverty, and my class project was about poverty among refugees. And I loved it. I technically didn't step a foot in my other university. I was barely attending classes. I finished it, but barely.
Just like,
yeah. So, and it was very clear that it was a mistake, but I have it in my CV. It's my journey, kind of like also learning from my mistakes.
I think it's so interesting because, you know, even with when you go to college, it's like we don't really know what we're trying to do. And so you took the logical route and I took the logical route. You know, I studied engineering too. I had no clue what I wanted to do at that point. I was like, oh, okay, maybe medical school. Maybe I'll do biomedical engineering and then go to medical school. And there's all of that it was not fun for me studying engineering. I knew I wanted to be in healthcare, do something like that, but oh boy, I totally feel you, you know, in that space. So you knew that you wanted to work with refugees. What were you experiencing around you, you know, with the Afghan refugees? What was life like for them at that point?
Discrimination was very obvious, and you could see that there is a divide. People in Iran would even recognize Afghans based on their face or the way of dressing or the accent, although we share a language. So they speak Dari. A good portion of Afghan population speak Dari, and then Iranians speak Farsi, and these 2 languages have over 90% overlap. But we can see that somebody is speaking Dari, not Farsi, based on their accent or words that they are using. So we could see that if you are an Afghan in Iran, the othering happens quickly. And there were people who didn't want to work with Afghans. There were people who didn't even want to be in the same space with Afghans.
What was the stigma, you know, around Afghans?
I think the narrative that is very common for any groups of immigrants or refugees, they are taking their jobs, they're taking our space, which I argue that it's never true. And the population of Afghans were huge. So there were points and a time that we had up to 4 to 5 million estimated Afghans in Iran. So there were considerable population. You could see them in the cities and pretty much everywhere you were living. And it was obvious that they have access to less resources. Part of it because rules and regulations in the country, restrictive immigration policies. Part of it was because of stigma and discrimination. And that was something that I wanted to do something about. And I didn't know what, to be honest. For a very long time, I had no idea. I didn't even know that there are majors that I can work with refugees. I started Googling that when I was looking for a major to study for my PhD. Before that, I had absolutely zero idea. So yeah, the extent of my thinking and my world was to, if I study something related to poverty, then I can do something. So that's why my major in economics helped.
What was the schooling, the interest to come to the States? Is that why you wanted to come to the States and study your PhD? Like what brought you from Iran to the US?
I think multiple factors. So I was at the point in my career that if I wanted to move forward, I needed either more education or more connections. So education was the easier route for me. At the same time, I didn't see a future for myself in continuing education in Iran. So my country at the time, and I think it's an ongoing practice, the government would flag the students that have activities that are perceived as sensitive based on government views.
Can you speak more? Yeah, can you speak more to that? Because that I'm just like, what does that mean?
Yeah, so we call it a star. So they get a star or they are starred, but it's technically flagged as doing political activities.
I see.
And based on that, in the process of background check, you can be prevented from continuing your education, finishing the current program that you're in, or at more extreme levels, being arrested. So I was not sure if I'm going to pass the background check to get into a PhD program. And PhD program in Iran, if you're going to government schools, which are the goodest schools in my home country, are very selective and background check is very serious. The interview process and all of that. And that background could have come up for me. So I didn't even apply for any PhD program in Iran.
Because you had a feeling that it was not going to work out.
I had a feeling that there's no point.
Right.
They would never, ever let me in.
Were there programs on, like, the program that you did at Washington University?
There was a school that just started a welfare program.
Got it.
There was a education in the welfare, with the welfare context that I could have enrolled in. But I just had a feeling that there's no way. I also never applied for any government jobs in my home country because of the same feeling. It was like,
got it.
There's no way that I would pass the background check. So my whole work background in Iran is at non-governmental organizations and United Nations, just because their background check and process is very different from government background check. So I started Googling majors related to refugees. And that was the first time that I even considered that might be something existing in that area. Right. And I found social work. And I started Googling the names that I knew. And based on that, I technically find majors. One of the names that I searched was the name of my PhD advisor, Miriam Pataski. Just because I cited her book and I had a copy of her book, Best Practices in Social Work with Refugees and Immigrants. So I had the copy of the book. So I come up with probably social work, probably her name. I Googled a couple other names, and those are the universities that I applied for. I ended up working with her during my PhD program. And I graduated with my name being next to her name on the cover of the book, the second edition of the book. So now it's our book.
That's amazing. You've gone through this PhD program. You have done, you've started to do extensive research within this space. What were some of the first challenges that you've, faced during this time?
Yeah, so when I came to US to get my PhD, the plan was for me to go back to United Nations and get a position, being promoted. That was my plan, pretty much until the very last year that I was graduating. So in my last year, I got a grant, very small grant. And then I had an exhibition called Sheltering Survivors, which we had real-size shelters and recorded interviews with refugees and people could come and walk through the shelters and listen to those interviews with refugees talking about their living situation.
Oh, wow.
Anyway, I was like, cool, people are giving me money to do what I care about? Like,
what?
So cool,
like,
I'm staying.
That's mind-blowing. What? Yeah, that's great.
Yeah, I was like, I'm definitely staying. I'm not going nowhere. Like, this is what I want to do. So I stayed in academia. What is very hard as an early career researcher, faculty, it's the amount of rejections you get.
Oh boy.
In this world. And it's just like, it feels like you're judged on daily basis. Like,
you build a lot of resilience, huh?
Yeah, there's like student evaluations, your annual evaluation, then there are like evaluations of your papers, reviewers give you feedback, and then your grants, conference abstracts. Like, you constantly put yourself and your ideas out there for people to judge and see if you're good enough. And I think that's the hardest part that I needed to learn and adapt with from previous positions that I had, and nobody constantly tell you no or sometimes telling you yes. But so I think that's the hardest part about being in this environment and just starting.
Yeah. When we spoke before, you kind of explained to me that like the majority of your work is around economic integration of refugees. I have my notebook. It's so like, it's so chicken scratchy. Like, it's just like when I do these like pre-interviews, I'm like, try to write down as much stuff as I can. But yeah, so you speak a lot about economic integration. And I think, that you saw that in Iran, right, with the Afghani refugees. And now you're seeing that in the States with so many different, people coming from all different places. Can you explain what economic integration is?
Yeah, so I think from very early on, I was struggling with the idea of poverty and why some people are poor, experiencing poverty and not. I experienced poverty when I was younger. So that was the context in my mind. And then my education helped me understand it better. And now I'm marrying my work between forced migration and my education as an economist together. And yes, my work is really, really focused on economic aspects of forced migration, poverty caused by forced migration, and then economic integration after resettlement and in host countries for refugees. What is economic integration? Good question. I just published a paper answering what is economic integration. Seriously, It was published 2 weeks ago.
Oh my gosh. Amazing.
I had a small grant from Russell Sage Foundation, and we wanted to design a survey questionnaire to measure economic integration. And then me and my research team sat together and we were like, but what economic integration is? And everybody can have a different answer to that question. So what we did is that we conducted a scoping review, which means that we systematically searched the published literature with extensive keywords. I think we reviewed more than 12,000, screened more than 12,000 publications, and we looked at them more carefully, smaller sample of that papers that we screened to see how researchers define economic integration for refugees and immigrants, specifically in the United States. And then we categorized them because there were multiple interpretation of what economic integration means. As we expected, many interpreted it as income, how much they earn, if they are poor or not poor. There were considerable number of publications looking at it from employment, if they are employed, if they are self-employed or working for someone. categorizing unemployed as not economically integrated versus employed as economically integrated. But there were papers who also looked at education, health, and looking at the domains as proxy indicators for economic integration. If they are using government assistance or not using government assistance. So if they are not using, meaning that probably they are economically integrated. If they're using financial system, banking, bank accounts, if they have access to those things, and their neighborhood and housing, do they have proper housing? So we categorized these indicators into 7 domains and said, okay, I think we can measure economic integration multidimensionally based on these 7 domains. When we were done with that scoping review and we just published the results, we were like, okay, so this is based on literature. What if refugees' perspective about economic integration is different? So now we are in the process of conducting interviews in my city, St. Louis, in Missouri, with 2 interviewers, one female interviewer, one male interviewer, both Afghans, both community leaders, who will ask refugees themselves, Afghan refugees specifically, what economic integration means to them. So we don't know.
Wow.
We haven't had the results, but I think combining what we found in the literature and what refugees themselves will tell us will give us a better understanding of what economic integration of refugees in the United States means. And we also have a plan to talk to service providers and ask them what economic integration of refugees means
to them. So service providers as in like social workers?
Yeah, those who have social work degree and other people who are working in resettlement organizations. I think many different people can come with many different backgrounds, but social workers are key population in that area who are directly working with refugees, helping them through their resettlement process. And some of them have decision-making power, like if they are going to refer the refugee to this service or not that service. And I think their perspective about what economic integration means can have a saying in what refugees get in that process.
I think that's so, what you're going to find is probably going to be so interesting. Yeah. I mean, like, I remember asking you just like, how do you even measure this, because there's so many different aspects to it. It's almost like does employment weigh more than your income? Does it weigh more than your housing? Like that's really a very tough job.
It is. And currently we are weighing them equally.
Got
the
it.
Domains that we have, we are weighing them equally. But we also discuss integration in each domain separately for the data to have a meaning. We had a pilot study, so we measured economic integration of Afghans based on these 7 domains in St. Louis, Missouri, and Portland, Oregon. But we also, besides saying that this is the overall multidimensional economic integration, we also discuss each domain because otherwise it wouldn't make sense. But yeah.
Yeah, wow. That's going to be really cool. You also mentioned forced migration. So I want to clear this up in terms of like what that even means, because for me, forced migration, does that just mean refugees, or does that mean like, is there a whole slew of people, under that umbrella?
Yeah. And that's a great point. So there are a whole larger group of people under that umbrella. And there are different definitions. So forcibly displaced populations, based on United Nations High Commissioner for Refugees definition, are only small category of forcibly displaced people that I think can be considered under that definition. But let's go with the UNHCR definition. It only includes internally displaced people who have been forced to displacement but never got a chance to pass an international border or did not want to pass an international border. For example, forcibly displaced Afghans inside the borders of Afghanistan are much larger population compared to refugees. Refugees and asylum seekers are the subgroup of forcibly displaced population who pass an international border to seek protection in another country. The difference between the two groups is that for refugees, their claim has been recognized by authorities. Authorities can be the government of the host countries or United Nations. It depends. But for asylum seeker, they have the claim, but it has not been recognized. And there's a group of stateless people, meaning that they are born in their country of origin, but they are not recognized as the citizens of that country. They are not refugees. They are not asylum seeker. Generation after generation, they were in the same country. That's their home country. Like Rohingya refugees or Rohingyas in general. The government of their country of origin does not give them birth certificate. So they are stateless. They do not have a state. So UNHCR only recognizes these groups as forcibly displaced population. But there are groups like forcibly displaced by extreme poverty who technically do not receive any protection from any specific organization. But what if you are forced to displacement because of drought in your village and extreme hunger? It can also be associated to climate change. But that group, the statistic of that group is not recorded by any organization, and they usually do not receive any recognition or a specific status compared to internally displaced refugees, asylum seekers, and stateless who have usually a status. Their numbers are counted and they receive some sort of protection.
Yeah, I did a couple interviews that kind of speak to that. I don't know why I'm blanking on the name, but in this interview, we talked about how refugees actually get more support than internally displaced people. And then there was another interview that I did with Mike Smith from Acclimate, and he speaks all about climate change, and he was talking about how now we're facing fatal heat temperatures, and that can force people out of their living situations. So that all of that is just so wow. Okay, zooming out here, I wanted to mention that the first episode I referred to was episode 5 with Elvis and Dasi. The name of the episode is How Do Internally Displaced Persons Access Healthcare? This was an incredible episode. Elvis is the founder and president of Unite for Health, where in 2021, one of his micro clinics provided free healthcare delivery for 47 internally displaced women. That's episode 5. And the other episode I mentioned that is featuring Mike Smith of Acclimate is actually releasing next week. I'm finally coming around to releasing the episode, so make sure you're subscribed and follow the podcast. Okay, back to the episode. Given the current global landscape, what do you think the most pressing issues in forced migration is?
The numbers are rising and they will continue to rise. Last year, 1 in every 69 human being, which is like a crazy number when you think of it. 1 every 69 human being was forcibly displaced. And under those 4 categories that we account for, which means that the actual numbers can be much, much higher.
Wow.
And we have 27 ongoing wars. None of them are getting better. None of them, absolutely none of them. None of them are close to be resolved. So, and wars and conflicts are the main reason for forced displacement, at least in the 4 categories that UNHCR recognizes. So the numbers will continue to grow, and the more and more people will be impacted. At the same time that we see that immigration policies are getting more and more restricted. So in other areas of science and crises in the world, it seems that countries are like, okay, this is happening. Let me get ready for it. Let me prepare myself.
Right.
Or scientists are doing the work that prepare people and countries for the future and what is happening. But it seems when it comes to forced migration, countries are like, okay, this is happening. I'm going to ignore it. I'm going to close my borders and we will have more restrictions in place. And I don't
Why
think
do you
that
think
this
that
is
is?
working.
Yeah. Why do you think that that's happening?
The narratives. I think the narrative is wrong. The fact that they think that there's a capacity in a country to accept specific number of people or not, the ceilings that they have, moving and continue life through moving has been a way of living for human beings forever. But I think now we are in an era that everybody is scared of that way of living, of moving and living. So protecting themselves means that closing the borders or closing their area of living to the movement or new people, which I don't think is the way of preparing yourself for the future, because forced displacement will continue to grow. People will continue to move. You want them to move or you don't want them to move.
They're still going to move. Yeah.
They're still going to move. It's a way of survival. It's not like they love to be refugees. It's like there's a difference between life and death, or like if they stay, probably there will be bombing or their family will be killed, their children will be killed. So they are escaping for their life. So you cannot prevent people from that. So I think the pressing issue is that we need to do a better job and have a better narrative to prepare ourselves from something that it's inevitable. Movement is inevitable.
Yeah. Can you kind of draw out some of the policies that are in place right now?
So let's look at the United States. So we have a ceiling for the number of refugees that we accept in this country. And that ceiling is set by the president of the country. So whoever is the president technically set the tone for United States to be a welcoming resettlement country or not welcoming resettlement country.
And is this number different for each country, or is it just a total number of refugees no matter where they come from? Like, what does that look like?
It's also different based on the country of origin, which makes it very, very complex. For example, they're saying we are accepting 60,000 refugees and this proportion will be for example, Afghans. Or in this 60,000, we are not accepting anyone from Iraq, which was the case. A couple years ago, we had travel bans. So refugees could be accepted, but not from specific countries. So it's always the combination of how many and how many from which country. And these numbers that do not necessarily translate the ongoing crises or the overall population of refugees. Population can be very large globally, but United States might not be welcoming of that specific population. They might be welcoming of another group. So the number of refugees who are entering the United States does not necessarily represent how big of that specific population from that specific country is. It's more political decision rather than humanitarian decision.
Do you think that it should be more of a humanitarian decision?
Yes, I do. I think resettling refugees is a humanitarian act. So it should be based on humanitarian motives, not political motives, not the relationship between the US and the country that they are accepting refugees from, or the country of origin of refugees.
And then it changes basically every 4 years or 8 years, right?
Yes, it's very random and it makes it much harder. So when the travel ban happened, I had a study ongoing in Jordan among Iraqi refugees in Zatari camp. Our interviewer was a young woman from Iraq who had an acceptance to come to US, and she was enthusiastically talking to me about she will come, continue her education and all of that. And then travel ban happened and they stopped processing. I lost contact with her completely. She stopped answering my text messages, phone calls, or anything else. So I think it was a short period of time. And then for a specific country, they started accepting refugees. But imagine, so getting acceptance for a country as a refugee to be resettled in can take between 5 to 25 years average. So imagine waiting that long amount of time.
And never knowing if you're ever going to get it.
And then a president changes and things can change based on a new administration. And that's one of the major problems in the United States, how many executive orders we have in immigration policy. Technically, we are heavily relying on executive orders at the moment and for the past 10 years.
You mentioned, the student that you met. I wanted to kind of dive a little bit deeper into the aspect of how this affects students or highly educated individuals, right? So in your recent study, you call them HEIs.
Yeah.
How do you think this affects these people who want to contribute to society, whether get their PhD like you did, get their master's, work in a job? How does that affect them?
Yeah, and I'm so happy that you brought the topic of highly educated immigrants up, because this is not my main area of research. It was kind of like something that I did for myself. It was very personal. When I graduated, I was on student visa. Then I moved onto work visa, and then I became a permanent resident. And my journey was so difficult, so stressful. My health was so impacted in this process that I promised myself that I will write about it. And I did. So I said, there will be one paper, one project about highly educated immigrants. I got a very small funding. And I said, okay, this will be something that I will document for myself. But it has started to be years of ongoing project because, first of all, people keep reaching out to us, wanting to share their stories with us. And students are joining my team who want to work on this topic. So it has been 4 years that I'm continuing doing this research, specifically with highly educated immigrants. And I had no plan to be in this area, but now it's one of our important areas of research. I have 4 doctoral students having projects related to this topic, all highly educated immigrants. So back to your question, immigration policies impact highly educated immigrants in their day-to-day life. The uncertainties that we have in the United States about immigration policies, you can go to sleep and wake up next day with a policy changed executive order that can impact your life, which happened to me. I went to sleep, I woke up, I was not able to travel anymore.
What was that policy that came into play at that point?
It was the travel ban.
The travel ban.
Had three different versions, and oh my God, how stressful was going through all 3 different versions. Cause you will constantly look for the name of your country to see if it's still in this version, the next version. There were courts that were returning the executive order, and there were specific states that were still accepting people from those countries until it went to the Supreme Court and become final for years. And during that period of time, my parents had chronic health issues that I really, really needed to be present. And I couldn't. My mom had an accident. I was not able to be there. I constantly have to make a choice if I want to finish my PhD or if I want to be with my parents and not able to come back and finish my PhD.
So you'd be able to go, but then not come back.
Not come back, because you can leave, but based on a travel ban, you cannot re-enter the country. There were waivers on case by case cases, but you would never risk that. You don't want to see if your case will be the one that gets the waiver or not. And then these were very hard decisions that I don't think any highly educated immigrant needs to make, like choosing between education or being with their family. I had a multiple entry visa, which I was afraid to use. And the other aspect is fear. Sometimes the rules and regulations do not directly impact you, but the fear of them that might or may not impact you, that you have to live with those constant fear and weighing the risks. That's the hard part. And there are lots of uncertainties, lots of changes when it comes to immigration policies in the United States.
You know, something that I noticed when I was in school, you know, I was born in New York, so I'm a US citizen, and I didn't have to deal with any of this kind of thing. And it's interesting because when you go to the career fair, right, and you want to get a job, if you're an immigrant or if you're on a visa or something like that, a lot of times you need to get sponsored, right, by the job. I can't believe how many companies were like, we don't sponsor visas. We don't do this. It's like, it's hard enough to get a job in the States. Like, I heard that, you know, hiring is at an all-time low right now. And to be an immigrant and want to provide for yourself and your family, how much harder it is to find a job that believes in you and wants to sponsor you. It's crazy. Like, I was reading your paper, and there were so many instances where I don't know if my job will continue to sponsor me, or I don't know what I'm going to do now. Maybe I'll stay in school because if I graduate, then I might get deported.
Yeah.
What?
Yeah, the complexities and the abuse that can happen because of that. So first of all, there are many companies that say, no, we would not sponsor work visas. It's an expensive kind of a process, and the companies have to commit to that. So that's the first problem, finding a company that is willing to apply for your work visa. And then if you're in the industry, work visa is lottery based. Even if your company is willing and they really want you and they will pay and cover the costs and all of that, it's still lottery based. You apply, you have limited number of times that you can apply. It's not like you can endlessly apply. And each year there are limited number of times that they will open the lottery system. It can be one time a year or twice, depending, and that year and the policy. So you apply your first and second. Usually you cannot only apply 3 times.
And your name is put into a hat, and then it's swirled around, and then somebody closes their eyes and just picks a name.
Yeah, because only a small portion of the application will get reviewed. And yours might not be among them, even if you find a company that it's willing to sponsor you and pay all the costs. So that's another layer. And then imagine that you're among the luckiest one. You found a company that is sponsoring. You are lucky your name is among the ones that USCIS reviewed. Still, companies can really take advantage of you because your visa is valid until they are willing to sponsor it. So you technically do not have much of a choice of moving, because like if you move, you have to go through that process again, finding a company that sponsors you, going through the lottery system. And many stay just because that process is very risky. Many do not negotiate or renegotiate their salaries or are willing to work with lower pay just because the companies make them do it if in return of sponsoring their visa. If they don't like their coworkers or supervisor, usually they have very limited room to change their situation. Many immigrants stay in jobs that they do not want or environments that it's not friendly to them out of forced choices because of the system that your technically existence and being in the US depends on the company or organization sponsoring your visa.
Yeah. And talk about how this can affect these people's like health, you know? Because you wouldn't think like all of these things are so interconnected, but it's actually, it just boils down to somebody's own health.
Yeah. We conducted so far, I think, more than 100 interviews between the couple of studies we have ongoing. And I can tell you in more than half of them, people start crying in the middle of the interview. You can see the amount of pressure that they are under because of their status. And these are highly educated immigrants. They have master's or PhD degrees. They usually have high paying jobs. So, in my study, we are looking at their salary range. Many of them earn more than 100K per year, which is a good salary. And they are still breaking into tears during the interview process. A sleep disturbance is so common that we started adding a prompt into our questions. How about your sleep? Because we heard it so many times that we expect them to have sleep problems. Depression, anxiety is very common. So we also added a prompt to ask them, so what's your stress level? What's your anxiety level? And then we have other health issues that people are talking about, gaining weight or losing weight, unwanted, diabetes or other health issues that are linked to considerable amount of stress and anxiety that they go through. So those are common health problems that we see in our interviews. And again, among a population that if you see from outside, you would be, these people, highly educated, good jobs, they're fine, right? No, not really.
It's hard to see because it's what other alternative do they have?
Yeah.
When you look at U.S. migration integration policies, you compare those to other high-income countries around the world. What do you see in that comparison? And are there countries around the world where you would take some of their policies and kind of implement them? If you had the power, right? If you were the next president of the United States, what policies would you enact? What would you implement?
Great question. So let me tell you this, that many of participants in our study had Canada as their plan B, just because they considered the migration policies there more welcoming, specifically for highly educated immigrants. So Canada, for example, is a country that has merit-based scoring system for immigrants and consider them deserving or not deserving to receive permanent residency based on that scoring system, which technically highly educated immigrants can score high because of their level of education and expertise and skill, which is not considered in the United States, except if you are working with an academia, non-governmental organization, or specific industries that you are exempt from the quota number of residencies that are granted every year or other things. If you're in industry, it's usually, you don't get lots of privilege for being highly educated, which in Canada is different. The other thing is that Canada provides rights to work more generously compared to the United States. we have extreme levels of restrictions for dependent visas in the United States. So if you're arriving in the US with a student visa, or for example, if you're on work visa, your privileges and rights will not transfer to your dependent. So an F2 visa, which is a dependent visa, to a student visa has absolutely no rights. So they have to stay home, do nothing. They don't have a right to work. They don't have a right to education. They don't have a right to anything. Similarly, a dependent to H1 visa has to petition for right to work separately. It's not like they will have a right to work automatically. So a dependent to a person on work visa, again, needs to stay home, do nothing. So they can legally not work. But in Canada, it's different. People have right to work. Dependents get right to work. Students can work outside of the campus, which in the United States, for that, you need a waiver. If you're a student, you can only work 20 hours inside campus.
I wonder why there's like an hourly cap. It's so weird.
Yeah, and all of that. So yeah, so we have much more, I think, compared to most of the high income countries, US policies are more restrictive when it comes to highly educated immigrants. And then we have H1 lottery visa, which is, I don't see a reason behind making something this random.
Right. I mean, in your study, and I'm going to link the study in the show notes and description, but
Thank you.
Yeah, like a lot of the recommendations that the students that you interviewed said, why can't it just be a first one for, like, you know, a first come, first serve basis, or even on a merit-based basis, rather than, oh, I'm just going to put my name in here and I have no idea if it's going to work out or not. You know, it's wow.
Yeah. I think another thing that it's very interesting about US is that USCIS is self-funded. So they don't receive federal funding. They technically are self-funded based on the money that they charge the applicants.
I see. Okay.
So it's also creates a very weird system. If an organization with that much amount of power is self-funded, for example, during COVID, just because of the policies, so most of the embassies were closed. USCIS did not have funding, so they had to fire considerable amount of their staff during that period of time, and that created a huge backlog in USCIS that will take a decade to resolve. And they had to increase the cost to create this expedited review process to technically review some of those applications based on their previous timelines, which is now much, much longer.
Right.
So this is a very unique situation that US has, that this such an important organization is self-funded, and USCIS is United States Citizenship and Immigration Services.
So they're basically like a for-profit that's like profiting off of students who want this visa. Wow,
Yeah.
that almost brings up like an ethical dilemma. Wow.
Yeah.
I think my last question to you, I love this conversation, but as someone who has experienced this, you know, herself, has seen refugees in two different places, you know, in the US and then back home in Iran, how do you balance, you know, doing all of this research and kind of the emotional weight of being so connected to the cause?
Yeah.
I feel as if it's almost like you need to do some self-care, because it brings up some experiences for yourself as well, right?
Yeah. First of all, I have a good therapist, and
that's awesome.
And I recommend that. Like if you're not feeling well, you always need to ask for professional help. I don't think that's like doing yoga or a sport, and these things can help if you really deeply need help.
Right.
Help of a professional. And I have needed that help many, many, many times in my life. The other thing is that working and this helps me heal.
Mm-hmm.
I think it's kind of my revenge. Like,
oh, I love that.
Talk about
yes,
highly educated immigrant, like it took like the very first project was my revenge. I was like, okay, I had a terrible experience. I'm gonna write about it.
Yes.
So that was kind of like,
it's like, yeah.
Now that paper is out there. You can see.
It's like cathartic, right? Wow.
Yeah. Or like, so in my field, in academia, you always try to work on topics that are popular because there is usually more funding in that area. But I never do that. Like, it happened to me that a topic that I was expert or working on became popular. But for a very same reason, and the satisfaction that I get from publishing about things that I care about or talking about things that I care about, I always pick the population or a problem that I really, really care. So I have been working with Afghans for more than 15 years, just because it's very, very personal to my lived experiences. And I get satisfaction out of it. I get satisfaction talking about the policy. I get satisfaction about Afghans who are in the United States, their problems. I get satisfaction out of designing interventions to help and get funding for that. So part of it is very joyful when something worked out, when I get the funding, when I get to publish about things that matters. And then one of the reasons that I choose United States over any other country, or possibly going back to my home country, because here I can actually criticize the government policies. Or I remember that in the previous election, I wrote an open letter to the president about the refugee situation. So I get to do all these. I get to write open letters. I get to publish papers. I get to get funding from the federal government to talk about problems with the federal government, which is fascinating. So I think it's a balance of, yes, it's hard, the stories sometimes.
And like you said in the beginning, the all of the rejections that you get too.
Yeah. That too. And now I have a project on South Sudanese refugees that we are listening to the stories, and I have to take long breaks because it's so hard to listen to their living situation. But when I get to publish that, I think that joy covers the hardship that was in the process.
Yeah. And you're able to create that awareness. I want to ask you one more question, because I feel like it's listeners of the podcast will really appreciate this. But I want to ask you, like, what advice would you give, like, your younger self, or somebody who is in, and it's kind of perfect because you're in academia, but a student who has had lived situations like this, who wants to make a difference? Like, what would you say to that young person?
Oh, that's such a good question. It's a journey. Like, take your time walking the walk. I think many, many times I was so worried about the outcome or getting there or being there that I forgot that it's a very, very, very long walk. And I need to learn that I have time. Nothing will happen quickly. I will have people to walk with me. And it's a very long journey. So I think that's the advice that I will.
Yeah. Change takes time.
Yeah. My younger self and other students to take their time, enjoy the ride along the way, and know that they are not alone. They will find people who care about the same topic. It's fascinating to me that a student send me emails and say they want to work with me because they care about what I care. This is perfect. This is like, what can be more joyful than this? That people want to work with me because they care about what I care. Perfect. So yeah, all that will happen.
Wow. Well, thanks for being here.
Thank you. Thank you for the opportunity. I really appreciate that.
Thank you for listening to this episode. If you'd like to learn more about today's topic and guest, head over to the show notes linked in the description of this episode. There, you can get access to resources, links, and ways you can get involved in the pursuit for global health. And if you loved this episode, don't forget to write me a review on Apple Podcasts and rate the podcast on Spotify. It helps me get in front of more people just like you and continues to elevate the causes we are so passionate about. I'll see you in the next one.